Here I'm going to talk about the few NCLEX note, what is really important for NCLEX licensing exam, the common symptoms and sign of the disease. Pulmonary tuberculosis. So, pulmonary tuberculosis is an infectious bacterial disease characterized by the growth of nodules or tubercle in the lungs. So usually the patient present with cough with a thick sputum, also the sputum may contain the blood. Fatigue, weight loss, night sweat, and fever is the most characteristic sign symptom. Here we go, we say low-grade fever afternoon. So fever or temperature go up at evening time is a characteristics of pulmonary tuberculosis fever. And late stage patient complain shortness of breath. Next go pneumonia. So pneumonia, it is the infection of the lungs and characterized by severe cough, right? Fever, chill, and difficulty of breathing. But here we can see the picture, rust color sputum. The picture here, characteristics of pneumonia. Rust sputum. In case of asthma, we see wheezing on expiration. So if you put the stethoscope, you can get a musical sound, wheezing. In case of emphysema, we say patient has a barrel-shaped chest. You see the picture, it is called barrel-shaped chest. Emphysema is a lung disease which results in shortness of breath due to the destruction and dilatation of the lung alveoli. When you examine the patient, you can see the chest is look like barrel shape. Next one is Kawasaki disease. The characteristics nature of Kawasaki is strawberry-like tongue. We call strawberry tongue. So Kawasaki disease, also known as mucocutaneous lymph node syndrome. It is an inflammation or swelling of the blood vessel throughout the body, most commonly affected the children and patient present with a high fever. Next one is a pernicious disease. Pernicious disease. In pernicious disease, we can see red beefy tongue, like this picture. Tongue is look like beefy tongue. So pernicious anemia, it is a condition in which not enough red blood cells are produced due to the deficiency of vitamin B12. So the major underlying cause of pernicious anemia, deficiency of vitamin B12. And when you examine the patient, you can see their tongue is red, beefy tongue. In case of Down syndrome, we see protruding tongue. Look like this picture, tongue is protruded. Down syndrome is a genetic disorder. It is associated with physical growth delay. Also characteristics, facial feature, and mild to moderate developmental or intellectual disabilities. Next one is cholera. So In case of cholera, what we can see? Rice-watery stool. Cholera is a bacterial infection which spread through the contaminated food and water. Next is malaria. So malaria, the nature of fever is called stepladder-like fever with chill. So malaria, a mosquito-borne parasite disease. And this causes the high fever or severe chill and sweating. Next is typhoid fever. In case of typhoid, the characteristic feature road spot in the abdomen and back, like this picture, road spot. So typhoid, a serious disease spread through the contaminated food and water, and it's causing high fever, abdominal pain, and diarrhea. Next one is dengue fever. Patient present with a fever, skin rash, and headache. Also positive Harman sign. Dengue fever, also known as black bone fever, a mosquito-borne viral disease. And this causes high fever, headache, and joint pain. Next one here is diphtheria. In case of diphtheria, patient develops pseudomembrane formation. So in this picture, we can see the whitish mass or pseudomembrane. Diphtheria, a bacterial infection of the nose and throat, caused by Corynebacterium diphtheria, organism name. The most common symptoms is a thick gray containing or thick white coated in the throat and tonsil. Next here, measles. In case of measles, we see cup-like spot. In this picture, you can see this is the measles spot picture in the top, and here is a cup-like spot. So measles, a respiratory tract viral infection commonly found in the children. And symptoms start with cough, fever, and then the skin rash show up. In this picture, you can see the white small spot because of measles. Measles is with complex spot on buccal mucosa. And this is an usually severe cases like this picture. And next here, systemic lupus erythematosus. It is the autoimmune multi-organ involvement disease. The most characteristic feature, butterfly rash. You can see this picture. The patient has a butterfly rash over both cheek. So leprosy, it is the characteristic sign, leonine faces, means thickening fold of facial skin. You can see the face, eyebrow, and ear. Because of leprosy, the skin is thickened. Leprosy is an infectious disease that damages the skin and nervous system. The condition can be cured with early diagnosis of the disease. Leprosy causes by the organism called Mycobacterium leprae or Mycobacterium lepromatosis bacteria. Usually the risk factor for developing leprosy person when come in contact, close contact with the infected person, and also reduce the immune function, malnutrition are the risk factor. Next here it is bulimia. The characteristic feature, chipmunk faces and parotid glands swelling. So bulimia nervosa is an eating disorder characterized by being eating, followed by method to avoid weight gain. Usually, patient brings eating, forceful vomiting, and also long-term fear of gaining weight. And also they have a strong negative self-image. And they have a tendency over use of laxatives or diuretics. Another disease called appendicitis. Appendicitis, basically inflammation of appendix. So if anybody have an appendicitis or inflammation of the appendix, let me show you a picture like here. So this is the appendix. You can see the picture. So a finger-shaped pouch usually present at the lower right side of the abdomen. If the inflammation is occur in this appendix, it is dull pain in the middle or right side of the abdomen and move down to the lower right abdomen. Usually patient present the symptom low-grade fever or constipation or diarrhea, nausea and vomiting, and frequency of urination. Inflamed appendix may cause in contact with the urinary bladder as well. Whatever the positive sign or diagnosis by physical exam, we found the McBurney's point should be tender. This is the McBurney's point. McBurney's point, how you find it out? It is 2/3 of the distance from navel. It is the navel, right? So it is the umbilicus, and this one is called anterior superior iliac spine. Right? It's 2/3 from umbilicus, 1/3 from anterior superior iliac spine. Most tender when patient has a appendicitis. Tenderness is maximum in case of acute appendicitis. The other sign of appendicitis are Robson signs should be positive. So if the patient has a positive Robson sign, he or she suspected to have an appendicitis. Also, we see a Schwartz sign. Schwartz sign means when patient movement the legs muscle, pain on the passive extension of the right thigh. When pain or it is present when the inflamed appendix, right? And another sign, it is called obturator sign, and or SWAS sign, also rebound tenderness positive. SWAS or obturator sign, patient feel the pain when they elicit by either the SWAS or obturator maneuver suggest irritation of the respective muscles by inflammatory process, such as appendicitis or ruptured appendix or pelvic inflammatory disease as well. And lab test, WBC count, if you count it, you can see WBC go up, complete blood count, CBC, or we also do for chest scan or CT scan of abdomen or pelvic, help to detecting the cause. Also, we do for magnetic resonance imaging, we call MRI or ultrasound. So MRI scan of the pelvic help in the diagnosis of appendicitis during the pregnancy as well. Next here is called meningitis. So meningitis, it is the infection of meninges, and meninges protect our brain tissue. If patient have meninges or meningitis, usually causes the stiff neck, headache, and fever. So meninges, patient most of the time present with the headache, with nausea, vomiting, decreased appetite, confusion or difficulty of concentrating, seizure in very late stage, and also lethargy. So how we can diagnosis? We diagnosis by Pernicious sign and here Pernicious sign and Brudzinski sign. Both should be positive. Let me explain one by one. Pernicious sign means knee is flexed 90 degrees, hip flexed 90 degrees. Elicit the pain or limited extension. So when healthcare provider demonstrate the symptoms of meningitis, is a Pernicious sign should be positive. Also, severe stiffness of the hamstring muscle. The other sign is called Brudzinski sign. So neck stiffness, positive flexion on the neck. Right? So meningitis sign, Brudzinski, or we call knockout rigidity. One of the demonstrable symptoms of meningitis is a Brudzinski sign. Severe neck stiffness causes a patient's hip and knee on to flex when the neck is flexed. The next here, next one, tetany and tetanus. Tetany, it is the involuntary movement of muscle because of hypocalcemia. So if the calcium level go down, patient develop tetany or tetani. If patient have tetany or tetani, we see the two signs supposed to be positive. One is called chopstick sign, like this, and Trousers sign. Here we can see the chopstick sign, means the spasm of facial muscle when facial nerve is strapped, like examiner hand. And trouser sign, it is the carpal spasm induced by blood pressure cuff. So, as I told you, tetani or tetany, involuntary muscle contraction because of low calcium. Chopstick sign supposed to be positive. Examiner trap the facial muscle and spasm of the facial muscle. And also trouser sign, carpal spasm when blood pressure machine is induced by cuff. So hypocalcemia or hypomagnesemia can lead to convulsion and cardiac disease may develop. Let me explain a little bit more. Hypocalcemia manifestation, weakness and tetany. Positive, trousers and chopstick sign, laryngeal stridor, dysphagia, also tingling sensation around the mouth, right? And next go it is tetanus. So tetanus, we see the writer's grain. So in this picture, you can see because of tetanus, sometimes it is called Clostridium tetani. And tetanus is an infection caused by bacteria, particularly Clostridium tetani. So bacterial infection by Clostridium that affect the nervous system causes the muscle contraction in jaw and neck. Sometimes we call lockjaw. Other days here it is pancreatitis. Pancreatitis means inflammation of pancreas. When inflammation of the pancreas, we can see two signs supposed to be positive. It's called Collin sign and Turner sign. So let me show you here. Pancreatitis, Collin sign supposed to be positive. So irregular hemorrhagic spot or patch around the umbilicus. And gray Turner sign, it is bilateral flank ecchymosis and classical findings of bleeding into the retroperitoneum around the kidney or pancreas. Both supposed to be positive in case of pancreatitis. Next, pyloric stenosis. We can see olive-like mass. Another one, intussusception, sausage-like shape mass. So this one is together, I want to explain. And let me go in the picture. Here, pyloric stenosis. We can see olive-like mass. It is a condition in infant in which the narrowing the opening from the stomach to the small intestine. So narrowing, so or thereby preventing food from entering the small intestine. Another one here, this one is called Hunchback's disease. Hunchback's or intussusception. So Hunchback's disease, particularly other name is called a ganglionic megacolon. You see how big it is? Or congenital megacolon. It is a birth defect where missing the nerves in the intestine and causes the problem with passing the stool. In case of intussusception, in this one, intestinal obstruction that result from a part of the intestine fold into the next part. So you see the part of this ileum get inside the cecum or ascending colon, get inside. Now we're saying in case of pyloric stenosis, we can see olive-like mass. In case of intussusception, we can see sausage-shaped mass. Now, next one, patent ductus arteriosus. This is the defect of newborn, congenital defect, and we can see watching machine-like murmur, abnormal sound is found. Addison disease, we can see bronze-like skin or pigmentation like this picture in case of Addison disease. So next one, yeah, you see the color accumulated causing the stimulation of melanocyte, bronze-like skin, characteristic feature of Addison disease. In case of Cushing syndrome, means when, adrenal gland secretion hormone is too high, moon phase appearance and buffalo hum. Here, Cushing, buffalo hum phase look like it was here, but then moon phase. Also, abdominal striae is there. Next, Graves' disease. It is hyperthyroidism. Excess T3, T4, but low TSS. Exophthalmos, this picture. Bulging the eyeball out of the orbit. Right? Here, bulging eye because of thyroid gland is going to bigger, diffuse goiter. Right? So next here, deep vein thrombosis. What we can say Homen sign should be positive. So what is Homen sign? This one. So you see, because of deep vein thrombosis, Homen sign is considered by some healthcare provider to be the sign of deep vein thrombosis. So when you one hand put in the heel, other hand just go for dorsiflex, forceful place to toe of the foot and patient complain of pain. So here, pain elicit from the to maneuver indicate deep vein thrombosis. Next, go. Angina. Patient complain of crushing or stabbing pain that is relieved by nitroglycerin. These are characteristics nature. And myocardial infarction, patient complain the pain is too heavy, like a stone, heavy stone over the chest. Crushing, stabbing pain that is radiate to the left shoulder, neck, and arms, and untreated or unrelieved by nitroglycerin, but angina relieved by the nitroglycerin. So in this picture, we see the pain start from left part of the heart, chest, then radiate to the left side of the neck, left shoulder, along the left arms. So what patient complain about this? Patient said the chiefly retrosternal pain behind the sternum, most commonly radiate to the left shoulder and ulnar aspect of the left arm and hand. May also radiate to the neck, jaw, or back and abdomen. Common description of pain by the patient, they said, my pain looked like constricting. Something is very tight over my chest. Crushing weight on or pressure. Or patient said, they have a shortness of breath, fear, perspiration, nausea and vomiting, weakness, collapse, and coma if untreated. Next, go. In case of Parkinson's disease, we can see the pill rolling tremor. So usually rigidity and also trembling or tremor on the hand. Reduce the arm and also rigidity in the extremity. Shuffling gait, most common, and their face look like emotionless. We call Mark's face. Cytomegalovirus infection, we will see owl eye appearance of the cell. In case of glaucoma, when intraocular pressure increase inside the eye, we can see the tunnel vision. You see the picture? This is called tunnel vision. Retinal detachment. So this is the retina, and here showing the detachment. We will see the flashes of light or shadow with the cartilage across the vision. The picture you can see it is bigger here. So normal healthy eye, this layer retina. Here retina is detached retina. So a condition in which the retina gets pulled away from the normal position. And this is the normal vision, but the person who has retinal detachment, their vision look like this. Something is fall over their vision shadow. See? Shadow with the cartilage across the vision. In case of Burgess disease, it is intermittent claudication, pain at the buttock or legs from poor circulation, resulting impaired walking. So patient explain, when I walk, pain start. When I take rest, pain disappear. It is the characteristic nature of Barger disease, right? It's called intermediate claudication. Diminish the blood supply, causes the damage and even death the tissue. Necrosis develop. Obstruction of the blood vessel. Death tissue, decrease, necrosis, gangrene, ulceration. Here showing the gangrene formation, demonstrated with the auto amputation of the left middle finger. And next, go. So what wrote? Diabetic ketoacidosis. We will find acetone breath or fruity smell. Pregnancy-induced hypertension. Patient present with proteinuria, hypertension, and edema. Diabetes mellitus, polydipsia, polyphagia, and polyuria. Gastrointestinal reflux disease, patient complain heartburn. Spunk's disease, or called toxic megacolon. Patient has a ribbon-like stool. The picture I have shown before. Now, few information about the sexual transmitted infection in case of herpes simplex type 2. We can see the painless vesicle on genitalia. In case of genital warts, warts is 1 to 2 millimeter in diameter. Treatment is cryotherapy. In case of syphilis, painless chancre, chancroid, painful chancre. One is painless, other is the painful. Gonorrhea, green, creamy discharge, and painful urination. Chlamydia infection, milky discharge, and painful urination. Candidiasis, white, cheesy, colorless vaginal discharge. Trichomoniasis, we will see yellow, itchy, and foul-smelling vaginal discharge. This is the few notes frequently asking in NCLEX board exam. I like to request you just go over it and review again and again.